Hello, my friends. Every 4th of February is seen as World Cancer Day. Part of my specialty, what I also specialized in, is integrative care for cancer patients. How did I get there? So, in my early 20s, one of my relatives was diagnosed with leukemia, and it was a very hard experience for all of the family. And I still say till today that if one person is diagnosed with cancer, the whole family is suffering alongside with the patient. So, mind body medicine is based on the belief that what we think, what we feel, whatever happens with us, like big traumas, can definitely affect our health and well being, and they can be also precipitating factors to being diagnosed with cancer. And I also say that prevention is always better than treatment. So, for me, even personally, in my lifestyle, I lead a lifestyle that prevents diseases such as cancer, for example. And I will talk to you more about that. So, having said that, having only an oncologist on your team is not good enough. You need the support for you and your family in your battle. It's usually long, and to alleviate your suffering. So, suffering really on a deep level becomes a choice. And I do hope that you are not unconsciously choosing suffering. So the mind body therapies I implement for any person diagnosed with cancer that comes to me. And by the way, it's also recommended that at the point of diagnosis, you come to me as a mind body medicine doctor, as a psychotherapist, before you embark with your surgeries or chemo or radiation. So definitely I use REBT, rational emotive behavioral therapies, and this is what I trained in Mount Sinai in Icahn School of Medicine. In here we work on the A, which is definitely the activating trigger, the diagnosis, the B, the unhelpful beliefs, the C, the consequences. How is this cancer diagnosis affecting you mentally, physically, the symptoms, emotionally? Then I teach you how to debate those unhelpful beliefs, be it downing yourself, belittling yourself, self-hate, frustration, catastrophization, and others as well. And once we debate them, we can move forward towards healthier beliefs, effective beliefs, and functional consequences. We of course do relaxation together, and I teach you also breathing exercises to do every day. Movement therapies also I recommend, be it yoga, tai chi. Now, when it comes to nutrition and lifestyle, because even the father of medicine said, like, let nutrition be thy medicine. So nutrition for cancer is extremely important, and this is what I've been doing like since 2016, whereby I really decreased, even cut for a year, the consumption of sugar, refined carbs. I reduced the intake of vegetable oils. Omega-6, for example, is inflammatory, so my go-to is omega-3, which is anti-inflammatory. All the anti-cancerous foods such as turmeric, sulforaphane, or the broccoli, sprouts, the dark leafy greens, garlic, onions, green tea. I stopped meat, for instance, and all dairy products. I drink alkaline water. Limiting your alcohol consumption is also important. Avoiding the xenoestrogens. You can also ask me about what xenoestrogens are, or you can do some Googling. Exercise is, of course, very important. Anything that helps you, detox and sweat If you smoke, quitting smoking is very important. Getting the sunshine or really amplifying vitamin D. So in research, we know that vitamin D is also anti-cancerous, whatever like increases your immunity. And definitely, as I said, with REBT, so acknowledging your emotions without hiding them, accepting them, acknowledging them. Remember that whatever you are feeling with cancer is valid. Be it like the anger, the despair, the fear, the shame, the worry, the weakness, the fatigue, the grief, grieving sometimes a part of you, whatever part of you that has the cancer in it, be it the breast, be it the brain, the lungs, and keeping in touch really with a very close circle of friends that really know how to talk to you, so that you can also keep on sharing your feelings and experiences. So I do hope that this video has helped, and remember that only an oncologist is not good enough for you. You need a team that acknowledges, you know, your lifestyle, your emotions, so that it's more of a root cause approach also. So alongside each other is really what's best. Thank you.